microbiology review of bacteria for the NPLEX exam. Gram-negative rods and cocci. Bordetella pertussis. Gram-negative coccobacillus is a strict aerobe. A virulence factor is hemagglutinins. The infection causes pertussis, otherwise known as whooping cough. It has a catarrhal stage, which includes rhinorrhea, copious and mucoid, as well as symptoms of a cold. There is also a paroxysmal stage, which has a severe cough, anorexia, and vomiting. A convalescent stage, which is less severe, and can lead to pneumonia, eye hemorrhages, and hernias. Chlamydia trachomatis is an STD and also can be transferred during the delivery of a baby. It is a gram-negative bacteria and is intracellular. The infections can lead to urethritis in men as well as milky white yellow discharge in women. It can lead to pelvic inflammatory disease and also has milky white yellow discharge. This is also known as a silent epidemic. The neonate infections can cause self-limiting conjunctivitis and may lead to blindness in areas such as Asia and Africa. Chlamydia pertussis is found in birds, is an intracellular gram-negative bacteria. The intracellular form is known as reticulate bodies and can be visualized with fluorescence antibody staining. Pistachosis, otherwise known as parrot fever, is a version of walking pneumonia. Escherichia coli, otherwise known as E. coli, is a gram-negative rod, has metallic sheen on an EMB agar, and is lactose positive. The intestinal infection can be enterotoxic, otherwise known as traveler's diarrhea. It is non-invasive, watery diarrhea for several days. Enteropathogenic E. coli causes destruction of microvilli and leads to watery diarrhea, which may become chronic and occasionally bleeding. Enteroinvasive E. coli leads to bloody pus diarrhea, and enterohemorrhagic E. coli may lead to hemolytic uremic syndrome and can be found in hamburgers with cattle feces. Klebsiella pneumoniae is an opportunistic nosocomial infection found in hospitals. It is a gram-negative rod and is lactose positive. It is found in a capsule, which interferes with the immune system's phagocytosis and may lead to pneumonia. This is a most common cause of pneumonia in alcoholics and can also occur in diabetic patients. The abscesses are caused by it, as well as dark red bloody sputum, otherwise known as currant jelly sputum. Enterobacter aerogenes is an opportunistic nosocomial infection, which is also a gram-negative rod and lactose positive. It resides in a capsule and can frequently colonize hospitalized patients, especially in antibiotic treatment, and may lead to urinary tract infections. Citrobacter freundii is an opportunistic nosocomial infection that is a gram-negative rod and lactose positive. It occurs in hospitalized patients, causing sepsis and urinary tract infections. Salmonella enteritis is a gram-negative rod that is highly mobile, hydrogen sulfate positive, and lactose negative. It is the main causative agent in poultry products. It is a self-limiting disease, very invasive food poisoning, causes fever, and produces an inflammatory but watery diarrhea. Salmonella typhi can only colonize in humans. It is a gram-negative rod, highly motile, and lactose negative. Typhoid fever comes from this invasion. Person-to-person contact, typhoid Mary, is associated. It can also enter the intestinal lymphatics and cause a onset of fever that increases from 102 to 105 degrees, and can also cause hyperplasia and necrosis of Peyer's patches, and causes a characteristic rash called rose spots that may appear on the abdomen. Clostridium perfringens is a normal flora of the human vagina and intestines. The spores of Clostridium perfringens are found in the soil, and transmission can be contamination of a wound or contaminated food. It is a gram-positive spore-forming anaerobic rod, and has anaerobic cellulitis, micronecknosis, otherwise known as gas gangrene, which leads to pain, edema, crepitation, or gas, and massive tissue destruction. In food poisoning, it is very common and leads to severe cramping and secretory diarrhea. Clostridium difficile happens in hospitalized patients. It is a gram-positive spore-forming anaerobic rod and can release toxin A, which is an enterotoxin, and toxin B, which is a cytotoxin that kills mucosal cells. It is the most common cause of hospital diarrhea and can lead to pseudomembranous colitis. The diarrhea is not bloody and usually follows antibiotic therapy with clindamycin. Bacillus anthracis can be found in the soil in spore form, as well as the skin of animals such as goats, sheep, and cattle in their hides. It is a gram-positive spore-forming rod and has a polypeptide capsule which has protective antigens, a lethal factor, and an edema factor. Its infection can lead to red raised lesion, which progresses to a black necrotic lesion with a rolled region. It can also lead to pulmonary anthrax, also known as wool sorter's disease, which can cause marked hemorrhagic necrosis of lymph nodes. Bacillus cereus grows in rice and has spores that survive boiling. It is a gram-positive spore-forming rod, which has enterotoxin and can cause cholera-like infections and staph-like infections. It is the most common cause of hospital diarrhea as well, and is very common in rice and buffets. The staph-like infection is a short incubation, whereas the cholera-like infection is a long incubation. Going on to more gram-positive rods and causae, there is Treponema pallidum, which is found in the human genital tract. It is a sexually transmitted disease and can be transmitted from mother to fetus. It is a gram-negative, spiral-shaped bacteria visualized using dark field microscopy. It is very motile and fluoresces directly antibodies. This is syphilis, a multi-stage disease. Primary syphilis has an incubation from 10 to 90 days and manifests on the genitals. Secondary syphilis leads to flu-like disease with infectious fat and hyperpigmented rash, as well as a rash on the trunk and extremities. This is the most infectious stage of Treponema pallidum, syphilis. Tertiary syphilis can lead to aortitis, as well as gumas in the bones and skin or viscera, and congenital syphilis is transferred to the fetus. Leptospira interrogans is found in wild or domestic animals or animal urine in water. It is a gram-negative, spiral-shaped bacteria with hooked ends. Leptospirosis is a biphasic illness with an early stage of fever, chills, intense headache, and conjunctival suffusion, as well as a later stage which may lead to aseptic meningitis, as well as liver damage leading to jaundice in severe cases. Borrelia burgdorferi is found in white-footed mouse. Ticks that live on them deer ticks, black-legged tick, and the tick must feed for 24 hours. This is a gram-negative spiral-shaped bacteria that is highly motile and can change antigens in one of the fastest-growing diseases in the U.S. This is a bloodstream infection which leads to erythema migrans, a target lesion upon injection site, and may lead to neural and cardiac problems such as Bell's palsy, and the final stage will lead to joint problems. Gram-negative spirochetes. Vibrio cholera is found in water as well as shellfish in the Gulf of Mexico. It is a comma-shaped gram-negative rod with one polar flagellum. It grows best on alkaline media and is oxidase positive. The infection results from contaminated food, especially shellfish. It's an abrupt onset with intense watery diarrhea, otherwise known as rice water stools, but there is usually no fever or blood or pus in the stool. Copious fluid loss may lead to hypovolemic shock. Vibrio parahemolyticus is found in undercooked or raw seafood. It is also a comma-shaped gram-negative rod with flagellum and is as well oxidase positive. It has a cholera-like enterotoxin and may lead to gastroenteritis, which is severe watery diarrhea and fever, whereas cholera has no fever. This is a very self-limiting bug. Citrobacter baumannii is a gram-negative rod, can be found in a hospital setting, and found in many soldiers in Iraq. Pseudomonas aeruginosa is found in hospitals and is an opportunistic infection. It is a gram-negative rod that has a grape-like odor when cultured on McConkey's or EMB agar. The pigments are pyocyanin, which is blue, or pyoveridin, which is yellow-green under an ultraviolet light. It is motile and oxidase positive as well as an aerobe. It leaves a mucoid exopolysaccharide layer, which is very slimy, and also has enzymes such as elastase and exoenzyme S, as well as phospholipase C. This can be found in hot tubs and may lead to hot tub folliculitis, which is inflamed hair follicles, may lead to eye ulcers and foot wounds, as well as otitis externa. In burn patients, this will lead to blue-green pus and cellulitis, as well as septicemia. In other patients with cystic fibrosis, repeated pneumonias are common and may lead to death. Urinary catheters, IV drug users may cause endocarditis as well as urinary tract infections, and diabetic patients may have malignant otitis externa. Rickettsia is found on D. mecentor dog ticks and is transmitted via a tick bite. It is a gram-negative rod. It is intracellular and requires cellular adenosine triphosphate. This leads to Rocky Mountain spotted fever, which occurs best in the summer, has a very acute onset, starts from the hands and feet and moves inwards towards the trunk, and happens in eastern United States. Rickettsia prowazekii lacks a cell wall and leads to epidemic typhus, which is not common in the United States. It leads to a rash, but spares the face, palms, and soles. Rickettsia typhi is flea-borne, which is usually transmitted on rats, skunks, squirrels, and raccoons, but requires a flea bite to transfer. They lack a cell wall and leads to endemic typhus as well, and it happens in the southeastern and southern states, and is a milder form of endemic typhus, which leads to chest rash that spreads to the extremities. Neisseria meningitidis is found in the nasopharynx. It is a gram-negative cocci and grows best on chocolate agar media. It is maltose positive, catalase positive, and oxidase positive, and may lead to skin lesions and purple rash. It is found in young adults around the college age, and the most usual causative agent is strain B, Neisseria meningitidis. Moraxella catarrhalis is found in the nasopharynx. It is a gram-negative cocci and grows best on chocolate or blood agar. It is catalase positive as well as oxidase positive and can lead to a middle ear infection, bronchitis, sinusitis, and laryngitis. Mycoplasma pneumonia is found in the human respiratory tract. It is the smallest known bacterium. The tiny colonies on a culture look like a fried egg appearance. It has a P1 protein that it uses to attach to mucosal cells and also causes walking pneumonia, which manifests as fever, malaise, and headache. Most common cause of pneumonia in school-aged children. Ureaplasma ureolyticum is also a very small bacteria and can lead to non-gonococcal urethritis as well as non-gonococcal prostatitis. Neisseria gonorrhea is transmitted via sexual contact or the birthing process. It is a gram-negative diplococci that looks like a kidney bean. It grows best on chocolate agar media. It is maltose negative, but catalase positive and oxidase positive. This is the number 2 most prolific sexually transmitted disease amongst 15 to 25-year-old humans. It is characterized by urethritis, yellowish-green purulent discharge. In women, it may be asymptomatic, but also causes vaginal discharge that is green or yellow, and it may lead to salpingitis or pelvic inflammatory disease. Neisseria gonorrhea can also cause septic arthritis, as well as infant conjunctivitis. Mycobacterium tuberculosis requires respiratory droplets. It is a gram-negative rod and acid-fast, which means it's surrounded by a waxy layer. It grows in a cord or serpentine fashion and is catalase negative. It is associated with granuloma formation and divides slowly due to a lack of nutrients through its waxy layer. It can lead to primary tuberculosis, which causes caseous necrosis and may create a Gone complex in the lungs. Secondary tuberculosis may lead to miliary tuberculosis, which has symptoms of cough with bloody sputum, night sweats, anorexia, and weight loss. Mycobacterium avium intracellulare is a gram-negative rod that is acid-fast and has a niacin production of negative. It is an opportunistic bacteria that happens in immunocompromised patients such as AIDS or pulmonary infections and adults with pre-existing chronic pulmonary problems. Mycobacterium leprae. Humans are the only significant reservoir, as well as armadillos. Poorly staining gram-negative rods that are acid-fast and grows best at body temperature. It is an intracellular bacteria and may lead to chronic granulomatosis condition of peripheral nerves and nasal mucosa. It may also lead to tuberculoid leprosy, which results in large macula in cooler body tissues, especially the nose, outer ears, and testicles, as well as superficial nerve endings. It leads to anesthesia of the skin, but does not cause caseation. Patient mounts a strong mediated immune response in tuberculoid leprosy, whereas lepromatous leprosy is a more severe version of the disease, slow and progressive. It has often nodular and leonine facies, as well as foamy histocytes rather than granulomas, as well as our human response being very weak. This may lead to nerve damage, numbness, paralysis, lesions, and deformity. Helicobacter pylori is found in the stomach, is a gram-negative curved rod with tuft of polar flagella, and is urease positive. It leads to ammonia production due to the urease, and H. pylori will cause acute gastritis, gastric and duodenal ulcers, as well as type 1 carcinogen gastric carcinoma. Campylobacter jejuni can be found in dogs or poultry raw or undercooked products, as well as unpasteurized milk or rural wells. It is a gram-negative curved rod with polar flagella. It does not ferment. It is rapid darting motility and looks similar to seagull wing flagella, catalase positive, oxidase positive. It has an endotoxin, which causes inflammation and leads to food poisoning, bacterial enteritis. It may cause acute enteritis in otherwise healthy individuals, which only lasts 1 to 7 days. It may be a causative agent to Guillain-Barré syndrome. Legionella pneumophila is a water organism commonly found in streams, poorly staining gram-negative rod, and most common cause of Legionnaire's disease, a necrotizing pneumonia acquired by inhalation, most common in smokers and immunocompromised. It initially is a non-productive cough, and it also leads to Pontiac fever, which is flu-like, mild illness, and self-limiting. Haemophilus influenza is a normal component of the upper respiratory tract of humans. It is a pleomorphic gram-negative rod, which grows best on chocolate agar and has a satellite phenomenon. The encapsulated forms causes illness. Type B is most common. Otitis media and sinusitis are common in non-encapsulated forms, as well as bronchitis and pneumonia in people with chronic obstructive pulmonary disease. Type B encapsulated strains may lead to septicemia, purulent epidemic meningitis, or epiglottitis. Haemophilus ducreyi is most common in the tropics in southern United States. It is a sexually transmitted disease that has gram-negative coccobacilli. It grows best on heated chocolate agar with X factor, heme, but no NAD. This also leads to chancroid ulcers, which are painful, non-indurated genital ulcers. Otherwise, non-painful ulcers are syphilitic origin. Haemophilus vaginalis, otherwise known as Gardnerella, is caused by a change in the natural balance of pH in the vagina. It is a sexually transmitted disease, a gram-negative rod coccobacilli. It grows best on a mixed salt solution wet mount and will be seen with clue cells. Bacterial vaginosis may have a discharge of white or gray tinge from the vagina, as well as a fish-like odor that may be more obvious after sex or during menstruation. Proteus mirabilis and Proteus vulgaris is found in humans. It is a gram-negative rod, which leads to swarming, spreading colonies. It is highly motile and lactose negative. The capsule it is in circumvents the immune system's phagocytotic processes, and direct invasion may lead to urinary tract infections. It is the most common cause of community-acquired UTIs. However, P. Proteus vulgaris is a hospital infection caused by catheters. Yersinia pestis is found on wild rodents like rats, is endemic to the southwest desert, and is transmitted via flea bites. It is a gram-negative rod. It cultures best on Waison's staining that gives it a safety pin appearance. It is non-motile and lactose negative. It has an F1 protein capsule as well as V and W surface antigens. Direct invasion causes the bubonic plague, which begins with a flea bite and leads to symptoms such as fever, buboes, and conjunctivitis. The bacteria can spread to the lungs, causing pneumonia, which is highly contagious. The pneumonic plague is rapidly necrotic pneumonia and was responsible for a third of the population's death during the Middle Ages. Yersinia enterocolitica is found in domestic animals. Gram-negative rod grows in the cold best, non-motile, and lactose negative. It can lead to enterocolitis, which resembles appendicitis with symptoms of invasive infection, producing mesenteric lymphadenitis, terminal ileitis, and reactive arthritis. Shigella dysentery and Shigella sonnei is transmitted through 4 F's: fingers, feces, flies, and food. It is a gram-negative rod that is non-motile, lactose negative. It has a Shiga toxin, which is neurotoxic, cytotoxic, and enterotoxic in its effects. It can lead to bacillary dysentery shigellosis, which is self-limiting that resolves in a week, characterized by sudden onset, frequent low-volume stools with blood and pus, and can last only 1 to 4 days of incubation. Bacteremia is rare, very similar to entero-invasive E. coli, and invades only the colon epithelium. Clostridium tetani is found in spores in the soil and can enter into a wound site or drug users that do skin popping techniques. It is a gram-positive spore that is characteristic of a tennis racket. Tetanospasm causes blocking of the release of inhibitory mediators such as glycine and GABA, which leads to tetany, which is transported retrograde into the central nervous system. Tetanus leads to spastic paralysis, lockjaw, and rhisis sardonicus, as well as opisthotonosis, which is arching and rigid back spasms, and death from respiratory failure. Clostridium botulinum is found in spores that are highly resistant to the environment, can be found in canned or vacuum-packed food, which germinates in an anaerobic environment, and you must eat the ingested preformed spores. Alkaline vegetables are at highest risk, that is green beans, peppers, and mushrooms. It is a gram-positive spore and an anaerobic rod. Botulinum toxin blocks the release of acetylcholine. Botulism has food poisoning type characteristics, symmetric descending weakness and flaccid paralysis, but there is usually no fever. Infant botulism comes from honey, which leads to floppy baby syndrome. Listeria monocytogenes is found in the feces and gastrointestinal tract of animals. It is commonly found in dairy products, deli meats, and cheeses, and can grow in a refrigerator and can also contaminate the birth canal. It is a gram-positive rod arranged in a V or L shape. It grows best in the cold and has tumbling motility. One of its virulent factors is reorganization of cellular actin, and it has Listeria-lysine O enzymes, which lead to suppression of cell-mediated immunity, which may lead to meningoencephalitis, which occurs in neonates, and meningitis in the immunocompromised. In pregnant women, it will induce flu-like symptoms with fever and may lead to granulomatosis, infantile septicemia, which may initiate abortion or stillbirth and can also contaminate the birth canal. And also may lead to food poisoning, which manifests as watery, non-bloody diarrhea. There is fever, headache, cramps, but not vomiting. Corynebacterium diphtheriae is a bug found in the throat and nasopharynx. It is a gram-positive club-shaped rod, often arranged in V or L-shaped formations. It cultures best on Laufer's coagulated serum that stains blue or red, or as well as tellurite, which stains gray to black. It is non-motile and appears as Chinese characters. It has A toxin, which is an ADP ribosyltransferase that inhibits protein synthesis, as well as B toxin, which is a binding toxin. Diphtheria may lead to pseudomembranous pharyngitis, which does not invade the tissue, but produces an exotoxin, which then circulates and may result in myocarditis, as well as neuropathies. Its symptoms include pharyngitis with dirty white pseudomembrane made up of dead cells, fibrin, and gray pigment, as well as a bull neck, which causes hoarseness and stridor. The pseudomembrane may cause asphyxiation as well. Staphylococcus aureus is found in the skin. It is a gram-positive cocci found in clusters. The MSA plate is salt-tolerant. It is mannitol positive and manifests in golden yellow colonies. It is catalase positive and coagulase positive. It has enzymes that are coagulase, catalase, lactamase, hyaluronidase, and staphylokinase. It may lead to toxic shock syndrome, which has a super antigen effect. Skin infections from Staph aureus are impetigo, which is a superficial spreading lesion, usually manifests around the mouth, most often seen in children. It may also lead to necrotizing pneumonia, which is high risk for patients with the flu or hospitalizations, as well as COPD. It also may cause bone or joint infections, such as osteomyelitis, most common cause, or septic arthritis, which is found in children. It can also be in hospital settings and lead to acute endocarditis in IV drug users. The toxin Staph aureus secretes leads to gastroenteritis, can be found in protein-rich foods such as egg or potato salad, creamy pastries, or meats, causes rapid onset of vomiting, diarrhea, cramps, usually resolves in less than a day. Scalded skin syndrome has an abrupt onset with large blisters and exfoliation of the skin found in children, as well as toxic shock syndrome, which is associated with tampons, has a high fever, and leads to desquamation of palms and soles, as well as hypotension. Staphylococcus epidermis is found on the skin, as well as intravenous catheters or prosthetic devices. It is a gram-positive cocci that clusters. It grows best on MSA plates. It is mannitol negative and grows in white colonies. It is catalase positive, coagulase negative, and novobiosin positive. The cell wall has a polysaccharide capsule, and it manifests mostly in hospital settings on artificial heart valves, prosthetic joints, catheters, and shunts, and can be acquired after surgical or wound infections. Staphylococcus saprophyticus is found on the skin and is transmitted via sex. It gram stains positive, cocci, and clusters. It grows best on an MSA plate in white colonies. It is coagulase negative and novobiosin negative. It causes cystitis in adolescents and often affects usually sexually active females and may lead to urinary tract infections. Staphylococcus pyogenes, Streptococcus pyogenes, is found on the skin. It is a gram-positive cocci that appears in pairs or chains. It is small. It cultures on beta hemolytic agar. It is catalase negative and bacitracin positive. Has enzymes that otherwise known as streptokinase, streptolysin, hyaluronidase, DNase, C5a peptidase. Direct invasion may lead to pharyngitis, which is the most common cause of bacterial pharyngitis in 2 to 20-year-olds. May lead to strep throat with peritonsillar abscesses, as well as scarlet fever, which manifests as strawberry tongue and sunburn rash, but it spares the face and only spreads to the extremities and the neck and trunk. Skin infections that may result from strep pyogenes are impetigo, which has a gold-encrusted skin lesion that spreads from the legs to around the mouth, most often seen in children. It can also lead to cellulitis, erysipelas, which is raised, fiery red, advancing erythema on the face and lower extremities across all ages, and impetigo erythema nodosum, which are tender nodules, usually on the lower legs of females between 20 and 30 years old, as well as puerperal sepsis, which is purulent vaginal discharge during or soon following delivery of a newborn. Strep pyogenes may also lead to toxic shock syndrome and antibody-mediated infections, such as acute glomerulonephritis, which is autoimmune nephrogenic strains cause this, as well as rheumatic fever or rheumatic heart disease, which is an autoimmune reaction that occurs 2 to 3 weeks after the pharyngitis and causes migratory polyarthritis of large joints, carditis, subcutaneous nodules, erythema marginatum of skin, which can develop into rheumatic heart disease with mitral stenosis involvement. Streptococcus agalactiae is a vaginocervical tract habitant. It's transmitted from mother to child during delivery or during sex. It is gram-positive cocci in pairs or chains. It grows best on beta hemolytic agar in large colonies. It is catalase negative and bacitracin negative. Direct invasion of Streptococcus agalactiae leads to neonatal meningitis, the most common cause of neonatal meningitis, or neonatal sepsis, and may also lead to urinary tract infections in pregnant women. Enterococcus faecalis is normal fecal flora. It is found in the female genitourinary tract. It is gram-positive cocci in pairs or chains. It is alpha hemolytic agar and grows best on 6.5 sodium chloride and 40% bile agar. It is catalase negative. It affects the immunocompromised or hospitalized patients, as well as antibiotic or bowel and pelvic surgery patients. In rare cases, it can develop into subacute bacterial endocarditis. Streptococcus pneumoniae is a common urinary upper respiratory tract microbe. It is a gram-positive lancet-shaped diplococci. It grows best on lysed by bile. Optochin positive. It is catalase negative and quell lung reaction positive. It has IgA proteases as well as autolysin. It is the most common cause of acute immunity-acquired pneumonia and may lead to otitis media, sinusitis, and meningitis in adults. It has typical lower lobar pneumonia with rapid onset of chills and fever, which is identified with a productive cough, blood-tinged or rusty sputum in smokers, patients with COPD, and alcoholics. It may also lead to otitis media, which is characterized by an earache. Streptococcus viridans is found in the oropharynx and transmitted after dental procedures. It is a gram-positive cocci in pairs or chains and grows best on alpha or gamma hemolytic agars. It is bile negative, optochin negative, and catalase negative. It can be found after dental caries. It can also lead to infective endocarditis, which follows dental procedures or surgery, which may include symptoms like fever, heart murmur, anemia, splinter hemorrhages, Janeway lesions, and may also lead to brain abscesses following dental procedures or surgery. And finally, Actinomyces israeli is a gram-positive rod and leads to actinomycosis, which forms large abscesses on the head and neck that are painful, as well as lesions in the mouth, lungs, or digestive organs, and also occurs after dental work or with poor oral hygiene.